Ryan came to me several years after he'd had an elbow injury, a triceps tendon tear, in which he underwent a surgical repair. After that, he had some residual problems with it. He was able to do some things, some workouts, but not to the degree that he had wanted to.
I had my first surgery in 2013 when I partially tore the triceps tendon, just normal wear and tear over the years of regular lifting. And then back in October of 2020, re-injured it and tore the triceps tendon again.
The problems with doing another repair is that we know that tissue never healed in the first place. If you have weakness of the triceps and you don't have full strength, that can be very limiting. We got an MRI, we took a look at it, we discussed some of the treatment options.
From the beginning, talking to the PA, talking to Dr. Eichinger, went over all the different options. Once the MRI came back and confirmed what the issues were, I knew that if I wanted to keep doing what I was normally doing on an activity level, that I would have to take the surgery option, which I did about 4 weeks after the injury.
Ryan is such that, he's an athlete and he does very demanding CrossFit. And so when we talked about treatment for him, I knew that it was going to be a tall order. He needed something that was going to allow him to push weight, push his body weight, and do very demanding activities. What I told him I thought would be the best option would be to do a reconstruction, and we were going to actually take one of his hamstring tendons, so down from his knee, and basically make a new triceps. And so we did that surgically. We went first down to his knee to get that tendon. And then what we did is we used bone tunnels where it's supposed to be attached and wove it through his existing tendon and put it under the appropriate amount of tension to make that new tendon, to augment what he already had. We put him in a splint and basically kept him near full extension for a period of time to let things heal. And then we slowly over time had him do physical therapy and get back into his activity. And he was the perfect patient for this because as an athlete, he was really in tune with his body, and he really followed the protocol precisely and was able to gradually increase his tricep strength, and to the point now where it's pretty remarkable what he's able to do.
For the first 6 months, a minimum of probably 10 hours a week of rehab. Maybe 14 months after the initial surgery was when I started feeling like myself again. I knew I had some limitations, but was able for the most part to do everything. Being able to squat snatch over 135 comfortably with zero pain after, which is something that even after the first surgery I wasn't able to do. And doing that continuously and not having any issue, and it was comfortable, didn't hurt, was something that I was really excited about and was nice and surprising because I didn't think that was going to be an option.
It's a team approach, and the therapists that Ryan worked with had a huge hand in this, as well as all the people I work with, from the folks in the operating room who help me every day to do this, the residents that I work with. All those people are essential to us being successful with doing these kinds of operations.
If anyone's considering letting Dr. Eichinger operate on him, I mean, I've been to doctors up in the Boston area, down here, and by far he's the best individual that I would trust with doing something like this.
Taking somebody who's been told that, hey, you got a problem that I don't think we have a solution for, and being able to come up with something that not only works, but really allows them to do the things that they love to do, that's what I'm most proud of.